Hi, thanks for joining this presentation that's put on through the University of Vermont Autism Assessment Clinic. My name is Kimberly Krebs, and I'm a pediatric occupational therapist, as well as a professor in the Occupational Therapy doctoral program. My clinical background includes work in pediatric mental health, outpatient practices serving children from early intervention through adolescence, as well as specialty practice in sensory integration and feeding disorders. Today, we'll be discussing this module on regulation and sensory processing. I want to start off by defining occupational therapy, since it's a historically lesser known health profession. Occupational therapists support individuals in any meaningful and productive occupations, meaning any activity that occupies their time. When we say occupations, we do not only mean work, as it's used in mainstream vernacular, but rather occupations can include any activities that individuals want to do, such as leisure or hobbies, need to do, such as chores and daily activities like getting dressed and preparing meals, and what they're expected to do, like participating in social activities, going to school, and so on. Occupational therapists work with clients across the lifespan, from pediatrics to geriatrics, and with clients of varying ability levels and diagnoses. In pediatrics, occupational therapists, or OTs, work with children and caregivers in outpatient clinics, schools, hospitals, home health, and other settings. In these pictures, you can see some OT sessions in action. If you notice the girl in the upper left, she's in a sensory integration gym, and we'll talk a little bit more about that today. It looks like she's practicing balance and core strength on a suspended disc swing. The client in the upper right is seen engaging in functional mobility or ambulation and walking exercises while supported by a therapist holding a gait belt. The lower left shows a client utilizing an adaptive knife to engage in simple meal preparation. And finally, the lower right picture shows an older adult using assistive technology, such as a reacher, to successfully age in place. For the focus of this presentation, we will discuss the components of regulation, how OT may intervene, and some simple strategies to get started with at home if you are currently waiting for or wondering if your child may benefit from additional resources or services. So what is regulation? It seems like this term is tossed around to the point where it loses some of its meaning. The truth is, it's used to mean many things, so let's break it down a little further. Regulation refers to a whole host of skills which help us to feel balanced and ready to take on our day. It's the ability to attain, maintain, and change our arousal level appropriately for a task or situation. It is impacted by our emotions, our energy level, our social skills, our environment, and our routine. So there's a lot on this graphic in this slide here, but we'll dive into it a little deeper. Many factors impact regulation, including sensory processing, routine, and social emotional awareness. This is a lot to manage, especially when one of these areas on the left is off, let alone all of them. For instance, when a change in routine happens, we can expect that the right side will be impacted in some way. Before we go any further, I use the term arousal when I defined regulation. But what does that mean? In the neuroscience world, arousal refers to a state of the nervous system. It involves how we remain alert, attend to tasks, and regulate as environmental demands change. It can also be used to describe energy levels. For instance, a child who is jumping around excessively may be described as over-aroused. Similarly, nervous system arousal impacts the ability to regulate our own behaviors and emotions. States of arousal can fluctuate in different situations and throughout the day. This is completely normal. A helpful way to think about the band of optimal arousal. The wave-like appearance indicates some highs and lows. For instance, that first high point may represent when I drink my morning coffee, but that next slump could be that 10 a.m. kind of drop in energy. And the next upward bump may be when I eat lunch, followed by the 3 p.m. slump. So there's no right and wrong here. Arousal states are expected to change over the course of time. An optimal arousal refers to when there's a match between our environment and our behavior. For example, optimal arousal in a classroom may look like sitting quietly and paying attention, but optimal arousal at recess may look like running around and yelling out to friends. Back to our other slide about regulation, looking at the outputs on the right-hand side this time. From this list of attributes, we see that some skills are more emotional in nature, while some are more cognitive. So let's break this down a little further. Emotional expression, identification, and regulation are the outputs or ways that individuals demonstrate overall self-regulation. This can be defined as sharing feelings, anticipating triggers of possible dysregulation, being able to identify a solution to re-regulate, and recognizing emotions in oneself and others. Emotional identification may look like noting, "I felt sad when Billy took the toy I was playing with." Or it may simply be the recognition that when I'm tired, I'm more likely to be irritated by small hassles throughout the day. It may also occur by noticing physical sensations that are connected to an emotion. For example, my heart starts to beat faster. What might I be anxious about? For children who may not communicate through spoken language, consider how actions, nonverbal communication, habits, and communication devices may be used to indicate certain emotional states. Once a specific emotion or condition is identified, that emotion is typically expressed in some manner. At times, emotions may be suppressed in the moment, but usually surface later on. Feelings may be expressed verbally, as in the examples previously provided, or using nonverbal communication, such as facial expressions, body posture, hand gestures, or through their physical actions. Children are developing their impulse control and verbal communication abilities, so physical actions may tend to be the default method of emotional expression early on in life. Emotional modulation, that third column or box we see, has to do with the match. Thinking back to that band of optimal arousal, how does the emotional expression fit within the context or situation? For example, running and screaming is a-okay at recess time, but it's not expected in the classroom. Similarly, we may expect being somewhat disappointed if the grocery store is out of your favorite brand of cookies, but we would not necessarily expect crying for 30 minutes as a result. Challenges with emotional modulation present as unexpected or mismatched emotional responses in terms of the type, duration, or intensity given a particular situation, meaning the behavior does not seem to match the emotion, such as laughing hysterically when you're actually upset about something. The behavior may last longer or be more intense than what is considered safe or appropriate. Even though these behaviors or reactions may not be expected, I want to emphasize that this is not reason for punishment or reprimanding. Emotional modulation is an advanced skill that develops over time for children, and some kids take longer than others or need more support in demonstrating this regulational capacity. These are advanced skills that require insight into one's own patterns and preferences. Many people may struggle with these skills depending on the day, conditions like sleep, hunger, or the environment, how someone was raised and taught to express emotions. Remember, we think about nature and nurture, and neural development, since emotions are processed in multiple parts of the brain that develop at different times. Now, that was the emotional side of regulation, but this slide here represents the cognitive side. Executive functioning refers to a set of cognitive skills that help us to plan and problem solve, to change and adapt. These boxes here are all skills that fall under this umbrella of executive functioning. Managing routines means being able to follow a needed set of tasks to function independently each day, yet also remaining flexible if parts of the routine differ day to day. Inhibiting impulses means being able to override an unsafe or inappropriate action. For example, the feeling of needing to hit something when angry. This is how the cognitive side and the emotional sides may overlap. Self-management is being able to remember and gather needed materials to take care of oneself. This may be part of the school day by managing one's own materials and keeping an organized backpack to ensure learning. Problem solving. This is one that we're probably familiar with, being able to come up with appropriate solutions when faced with a challenge. Initiating tasks means sometimes getting started is the hardest part. Making the decision to engage in a non-preferred activity, or maybe even a preferred activity, but at a non-preferred time. Transitioning is moving from one activity to another when required or instructed. This may become challenging if your child is not ready or not anticipating the move. Sequencing refers to arranging or following a set of steps in a specific order. For example, to get dressed, we have to sequence putting on our underwear before putting our pants on. Planning is just as it sounds, formulating a plan in anticipation of an event. Now, there's a lot here. These skills develop over time and with practice, though it may take longer, or some children may require more assistance. For some children, using visuals or concrete objects to indicate a transition or the next step in a sequence may be helpful. For instance, having a tray in the bathroom with all the materials needed for a morning routine. So they're already laid out. You have your toothbrush and your toothpaste, face soap and a washcloth, and then your hairbrush. So everything is there in the order that your child needs it. We've talked about regulation from both the emotional and cognitive perspectives, but what about dysregulation? This may be a term that you hear therapists or teachers use. It defines when something goes awry with any or many of those areas we just discussed. It may present as anger, sadness, or temper tantrums, but what sometimes gets missed is that it also looks like hyperactivity, like that sensation of bouncing off the wall or extreme elation, or even some type of sensory discomfort. Remember, these are all emotions or energy states that we all experience at times. It qualifies as dysregulation when it differs in frequency, duration, or intensity to the point of impacting daily life. Dysregulation occurs when we fall above or below the band of optimal arousal, and it can be in any domain of arousal, meaning alertness, energy, muscle tone, attention, emotions, or anxiety. Thinking back to the examples earlier, each of these examples of dysregulation from before, the sadness, anger, elation, and hyperactivity, what all of these have in common is that they fall outside the band of optimal arousal. When dysregulation occurs, an individual is overcome with emotions that may feel like they're out of their control. This is where OTs step in to identify and anticipate potential triggers and step in with strategies to enable that match between the environmental context and emotion or behavior. Again, punishing or yelling at a dysregulated individual will not help, and in fact, it may likely intensify the presentation of overarousal. But what else can be done when this happens? Consider the situation. A dysregulated child is not only about the child. Every situation involves three main elements: a person in a certain environment, performing a certain occupation or task. Remember, occupation is anything that occupies our time. Occupational therapists look at each of these and the intersection of these elements, which result in participation, meaning a person's skills and abilities align with the environmental and task demands needed to perform a certain thing in a certain way. So we'll go through this in a little bit more detail. For the person circle, we consider individual personality traits, preferences and dislikes, strengths and weaknesses. This may include things like physical strength, the ability to pay attention well, avoidance of loud noises, and other things that are personal for a specific individual. For the environment circle on the lower left, we consider the external factors affecting a situation. This includes the physical built environment, the social environment, meaning other people that you may encounter, and larger contextual influences such as economic, political, and institutional infrastructures. For the occupation circle, the one to the right of environment, we consider the task itself, what is being done, and what is needed to accomplish it. This perspective helps expand focus beyond an individual person. In moments of dysregulation, it may not always be fair or appropriate to only expect the person to change. Instead, we can consider how to change the environment and/or the task/activity to facilitate participation or a return to a regulated state. Applying this perspective to a real-life example, we can imagine that you pick up your child from daycare at 5:30 after a long day of work. You can imagine how your own emotional or energy level may be impacted, as well as your child's. On the way home, you realize you need to stop at the grocery store to get several items in preparation for guests arriving to town tomorrow. The supermarket is crowded and noisy with last-minute weekday dinner shoppers. This scenario may be somewhat familiar to you, but if not, you may be able to imagine how it could play out. It could easily result in dysregulation, potentially in terms of an upset emotional state, or what we may call a tantrum on the child's part, or fatigue and low alertness on the parent's part. This would then likely impact the ability to complete the task, which is to get all of the items on the shopping list. But instead of telling your child to calm down or quietly encouraging yourself to pull it together, how could the environment or the occupation be changed? To change the environment, you might go to a smaller market in place of the large grocery store. Or you may wake up early in the morning to get groceries at a quieter hour before guests arrive. To change the occupation, you could have your child do silly animal walks, such as stomping like a dinosaur through the grocery aisles, or make it a scavenger hunt where your child has to search for a specific item and gets to cross it off the list when they find it. By switching up the environment and the task, it may make it more fun and more engaging, or it may just help regulate either one of you. Changing the environment and the occupation may not always be possible, but it does present alternatives to putting pressure on yourself or on your child to behave differently all the time. It can also be a nice way to explain regulation challenges to others, such as family members who may not readily understand that other factors are at play. I personally love using this tri-circle visual with clients and families because it presents a clear and concrete way to consider everyday factors that could impact behavior and regulation. Now that we have some background on the overall elements of regulation, connection to the nervous system, and focus on environments and occupations, let's dive in further to discuss sensory processing. Here we see two quotes from Dr. Ayers, who completed extensive research on sensory processing or sensory integration. These terms are frequently used interchangeably now. Dr. Ayers first developed her research and theories when working with children with learning disabilities. She developed evaluation and intervention methods that are now considered evidence-based for children diagnosed with autism spectrum disorder. The first quote reads, "You can think of sensations as food for the brain. They provide the knowledge needed to direct the body and mind." Here, Dr. Ayers discusses how our brains need sensory input in order to develop and engage with the world. It helps alert our brains to certain experiences that then get relayed to cause physical and emotional effects in the body and mind. The second quote reads, "Sensory integration is the organization of sensations for use," which defines this process of sensory integration. It states that sensory input comes in from the external world, is processed by the brain, and then organized for a specific use. The way we use it is displayed in our physical and emotional reactions. For instance, when you do a sniff test on leftovers that have been in your fridge just a bit too long, don't worry, we all do it. That smell input makes its way to the brain, where it then gets interpreted and organized to impact our decision-making and lets us know it smells a little funny, time to throw away the meat and potatoes. In order to discuss sensory processing, we have to understand the sensory systems, which receive stimuli and send it to the brain to be interpreted. Most of us probably learned about the 5 basic senses in school. These are the blue circles seen here. They include the sense of vision or sight, hearing or the auditory sense, smell or the olfactory sense, taste or the gustatory sense, and touch or the tactile sense. But there are also 3 additional hidden senses that we don't talk about as much. They're seen in the green circles here. The reason is they come naturally to many people, and they deal with internal sensations, meaning sensory input from within the body rather than from the outside world. Vestibular is the sense of movement, and it senses where the head is in space, which plays an important role for balance, posture, and movement across different surfaces. Vestibular input involves moving through space, such as by running, jumping, spinning, and dancing. Proprioception is the sense of body position. This senses activation of the muscles and joints, which is important for body awareness, grading of force, motor planning, and organized behavior. Proprioceptive input involves pushing or pulling against resistance, facilitating distraction, which is the pulling apart, or compression, which is the pushing together of joints. This type of input is said to be organizing for the nervous system, meaning it can help boost individuals who are under-aroused and can help settle individuals who are over-aroused. Interoception is the internal sense responsive to pressure receptors. This alerts us of internal sensations, such as needing to use the restroom, feeling hungry or full, and recognizing symptoms of illness. For each sensory system or domain, we have a certain threshold that has to be met in order to recognize and respond to a particular input. A threshold is the amount of sensory input the brain requires to produce an output response. For instance, an individual with a high pain tolerance means they have a high threshold, so they won't show as high or frequent of a pain response as many other people. They need to experience a more intense injury to register the pain. I like to teach my students and the families I work with to think about this as their sensory cup. For the coffee drinkers in the room, you need a certain amount of caffeine to help your brain feel ready to go and face the day. In the same way, the sensory cup needs a certain level of input for whichever sensory system we are thinking about to help the brain feel alert and ready. A high threshold is represented by a giant coffee mug, like the ones from the Central Perk on Friends, if any of you remember that show. And it takes more sensory input to fill this mug, and the brain and the body will continue to seek that input until it gets filled. On the flip side, a low threshold could be represented by a tiny espresso mug, which only requires a little bit of sensory input until it's full. In fact, it's easy to get too much input, resulting in an overflow, which may look like a tantrum, a fear response, or avoidance of certain activities in children with sensory sensitivities. Another way to describe the sensory cup is to think about sensory seekers versus sensory avoiders. There are in-between categories, but just considering these two extremes, the sensory seekers have large sensory cups, so they actively look for sensory input to fill their cup. Once the cup is filled, their brains and bodies are more readily able to quiet down. The avoiders have small sensory cups, so with just a little bit of sensory input, their cup may overfill, which could result in tantrums, shutdowns, like suddenly falling asleep, or withdrawal, like moving out of a space or emotionally moving inward to try to block out external stimuli. Of important note, the same person could seek certain sensations while avoiding others. For example, a child may seek movement input or be a vestibular seeker, but may avoid noise input or be an auditory avoider. Working with an OT will help investigate and make sense of these patterns to come up with customized recommendations and interventions for each child's specific profile. Now, we can think about this in terms of two imaginary case examples. Jack is a 5-year-old boy who is described as always on the go. He needs more movement to fill his sensory cup, and until it is full, he will continue to seek movement to fill it. So my goal as Jack's OT would be to front load our movement activities so we can fill his sensory cup. All along, I act as a sensory detective to find out what movement experiences he prefers and how much, in terms of duration and intensity, is needed to fill his sensory cup. Then, when his cup is full and his brain is satisfied, we can move on to less active activities, such as those targeting his fine motor skills. On the flip side, let's think about Nina, a 9-month-old baby who frequently cries during car rides, diaper changes, and when tossed up in the air by her dad as he playfully tries to calm her down. She has a tiny espresso sensory cup for vestibular or movement input. So when she experiences movement that is unexpected or out of her control, her cup overflows. She starts crying, clings to her parents in fear, and at times vomits. Her parents are worried and not sure why Nina's reactions are so strong compared to the other kids they know. Think about your child, or perhaps even yourself. What types of sensory experiences are sought out or even necessary for day-to-day functioning? Which experiences are difficult to tolerate and get in the way of getting things done? This is the type of detective work that goes on with sensory processing differences. Here we have another quote from Dr. Ayers. The brain locates, sorts, and orders sensations, somewhat as a traffic officer directs moving cars. When sensations flow in a well-organized or integrated manner, the brain can use those sensations to form perceptions, behaviors, and learning. When the flow of sensations is disorganized, life can be like a rush hour traffic jam. I love this image because it is relatable. Think about driving your regular commute home from work, from your child's school, or from the grocery store. These routes are likely automatic. There are times when it feels like your brain shuts off and you can function almost on autopilot. However, when an unfamiliar event happens, such as a car changing lanes unexpectedly, attention heightens. In the case of brain functioning and sensory input, this usually happens automatically. Sensory input enters the brain recognizes it and interprets it. So your eyes see that car changing lanes, or your ears might hear a horn toot. It goes to your brain and then it interprets it and quickly causes your foot to slam on the brake or causes some type of motor reaction. Dr. Ayers goes on to explain that sensory processing challenges can feel like a traffic jam in the brain when things are not occurring smoothly or automatically. Rather, sensory input gets stuck and the brain does not know how to make sense of it, which impacts the ability to respond with the expected motor and emotional reactions. This traffic jam may present as motor clumsiness, such as poor recognition of obstacles in the way, being accident prone, or a lack of gross motor or fine motor coordination. It may also present with emotional reactions, such as frequent tantrums, increased anxiety or fear, and avoidance of certain situations, as we previously discussed. When this traffic jam impacts daily life, intervention and strategies may be recommended to help sort out the process. For each sensory system, there are some strategies that could be trialed. We'll go through some of them now for each domain and for seekers and avoiders within each domain. However, please note that not all strategies work for all children. Working with a specialized occupational therapist will create a more individualized plan to help your child specifically. Visual seekers may enjoy spending a lot of time watching items spin or move repetitively, such as spinning toy car wheels, fixating on clock hands, and watching a ceiling fan. These individuals tend to prefer bright colors and patterns and seek out bright, fast-paced graphics. They may also learn best from visuals or pictures. Some strategies to support visual seekers could include incorporating visual-rich items that indicate an upcoming transition. For instance, the time timer is a big clock that displays how much time is left in an activity. There are also many visual timer phone or iPad apps available, as well as gel motion timers that use different colored liquid that moves from the top to the bottom. These can be found online or in some child toy or learning stores. Reach out if you want specific recommendations. Using pictures to break down steps of a challenging task can also be a helpful strategy. These can be printed pictures of your child doing the actual task, or more cartoon-like clip art versions, depending on what your child best responds to. Visual strips may be helpful for tasks like toileting, getting dressed, showering, and washing hands. These include images for each step of a task to support sequencing. Modeling other ways to play with items, such as rolling a car down a ramp, could be an alternative to spinning the car wheels. The important thing is to model without pressure to engage in any certain way. Gentle modeling of play skills still respects your child's sensory preferences and choice of play, while also introducing a potential new skill and way to play. Visual avoiders may become upset in sunlight or bright lights, especially when moving from a darker space to a brighter space, such as walking outside on a sunny day. These individuals may prefer to wear hats or hoods or keep their hair long to create blinders in the visual field. They may also avoid eye contact with others due to the intensity of this visual input, not as a sign of disrespect. This may also be an opportunity to educate others that fleeting eye contact does not necessarily mean a person is not listening to you. Rather, listening may look different in different bodies. It may be helpful to provide options for your child to acknowledge others in a different, more comfortable way for them, such as by saying hi or waving without necessarily looking at others. Some strategies to support visual avoiders could include giving your child control over the lighting in a space by allowing them to choose if blinds or curtains are opened or closed. A window shade in the car may support regulation during community outings. Having lights on dimmer switches or using light bulbs of different colors may also be a fun way to change things up. Allow your child to wear sunglasses and teach them how to request this accommodation. Sunglasses may also be helpful in other unexpectedly bright places, such as the dentist's office, when that bright overhead light is used to help the dentist view the mouth. Keeping environments as clear and tidy as possible could be helpful to support attention. Visual avoiders may be sensitive to or distracted by visual input. A worksheet window, so a paper with a little window cut out, may be helpful for school-age kids completing homework. This can help cover up background input or other problems that they're working on so they can just focus on the one problem at a time. Auditory seekers tend to prefer background noise and opportunities to make more noise. If you are not an auditory seeker, it may be helpful to reflect on your own regulatory responses to noise. This can be a tough situation if there's a caregiver-child mismatch with auditory preferences. So having strategies for yourself can support your own regulation. Some strategies to support auditory seekers could include incorporating sounds into daily tasks, such as using songs like the cleanup song as a transitional cue. Daniel Tiger and Sesame Street also have many songs about daily activities like toileting, eating, and brushing teeth that could be incorporated into daily routines. Engage your child in activities where extra noise is part of the task. Create the match between the person, the environment, and the occupation. Auditory seekers may do very well in music or dance classes. They may enjoy sports activities where added sound or echoing acoustics are part of the game, like basketball in a gym or gymnastics in a big wide open gym space. Talk about the sensory world. Auditory seekers may especially love to talk and to hear others talk. During walks or playground time, you can discuss what you hear and how different things sound. Auditory avoiders may become distracted or upset with loud noises, or even with more mild background noise, such as the hum of a refrigerator or ceiling fan, or the buzz of fluorescent lights. You may notice these individuals cover their ears or yell out in response to sudden noises. It may impact their engagement or openness to explore places that may be noisy, such as shopping malls, playgrounds, or public restrooms, especially now with the prevalence of automatic toilet flushers and hand dryers. Some strategies to support auditory avoiders could include limiting background noise or conversation. For example, turning the television off or creating a separate homework spot away from the TV room. Coming up with an escape or exit plan when you know you'll be in a busy area. This may include staying attuned to your child's cues that they're becoming overwhelmed, or once they become more independent, having them use a code word or a signal to advocate for when they need a break. Introduce earplugs or noise-canceling headphones, and strategies like covering their ears as needed. For those pesky automatic toilets, you may keep Post-it notes in your bag and stick one over the sensor to avoid any surprise flushes. Remember to consider the environment. Are there times or places that may be less busy to go on outings? Some places like movie theaters and museums now have sensory-friendly hours, which is an exciting new initiative and usually involves the place opening earlier or reducing sensory input at certain times. So they might use dimmer lights or lower the volume of movies. Tactile seekers may seek out frequent touch, such as running their hands along the wall while walking barefoot, or hugging others frequently. They may enjoy a wide variety of different textures and sensations, such as playing in dirt, slime, and sensory bins. And because oral sensory input in the mouth is processed similarly to touch input on the skin, these seekers may also enjoy chewy and crunchy snacks and may be more likely to chew on non-food items, such as fingernails, pencil erasers, t-shirts, etc. Some strategies to support tactile seekers could include sensory play with various textures. You can make at-home sensory bins using dry pantry materials, such as pasta, rice, or dried beans. Slime or gap, there are plenty of recipes that can be found online. Everyday items like shaving cream, foam soap, or even mud mixing dirt with water. Engaging your child in sensory-rich activities can also be fun, like gardening and cooking, those things that just naturally incorporate very sensory-rich tasks. Provide tactile input through a massage. Your child might like to be part of a massage train where they're giving a massage to a stuffed animal or a toy while also receiving massage input from a caregiver. Offer textured clothing or items to introduce tactile input. Many kids now like those sequin t-shirts where they might have a design made out of sequins and they can kind of rub their hands on the sequins. That gives them that feeling, and it's also some visual input mixed in there too. Fidget toys are things that they can hold in their hands and squeeze or twist. Those can sometimes be helpful, but often rules or parameters have to be associated with them, such as reminding your child that these are to hold, they're not to throw. Items that you can affix to a surface may be more appropriate or help out with those other behaviors. So things like putting a Velcro strip under a classroom desk, because it gives a little bit of textured input, but it's not something that can be taken off or dropped or left behind. Sometimes a wristband can be a nice way to introduce texture as well, and it could stay on their body, and it might be something your child can pull or rub, but not necessarily take off. Using chewy tubes or resistive snacks throughout the day may be helpful to redirect any chewing behaviors that may become unsafe. So if you notice your child likes to chew on those pencil erasers or on the seam of their t-shirt, you can offer things like fruit leather, dried fruit, Twizzlers, anything really chewy and crunchy to give them that input, or using a silicone tube or item outside of meal times that still gives them that input. Tactile avoiders may become upset or aggressive when touched, especially unexpectedly. These individuals may avoid certain clothing, especially if the fabric is uncomfortable, and they may be especially sensitive to tags or seams. They may avoid eating with their hands or engaging in messy play, like the sensory bins we just discussed for the tactile seekers. Some strategies to support tactile avoiders could include advocating for your child and educating others on this type of sensitivity. Providing options in place of hugging or kissing family members may be helpful, such as offering, do you want to give grandma a hug, a high five, or a wave? As your child becomes more independent, we can help teach them to self-advocate for their own preferences. Avoid unexpected touch, such as a hug from behind. Avoid light touch, such as tickles, because that can be more aversive than deep pressure, which is more of that massage feeling. When touch is necessary, help provide a warning and an explanation, such as going to the doctor's office and letting your child know why the doctor might be touching their back or touching their belly. Practice calming strategies in regular day-to-day life, not necessarily when a child is already upset, because nobody's really ready to learn when they're feeling upset or angry. Things like, if a classmate accidentally touches your elbow while waiting in line, what could you do? Let's practice taking some deep breaths so you remember how to do it when you feel surprised or upset. And for children who might not be speaking yet or may not respond as much to verbal language, this could be something that is modeled. It could be modeled through television clips or through use with their stuffed animals, or involving a sibling in the exercise as well, so that they could kind of imitate them. Keep wipes or a damp towel close. Following your child's lead during messy play and avoid forcing them to touch anything. So this can be helpful during that intentional sensory play or even during meal times. Offering utensils with finger foods or having that wet napkin available so they could wipe their hands right away. Meet your child where they're at and show them compassion and understanding when things are hard. It is actually painful, or it might feel more intense when they touch this input, even though it may not necessarily make sense or be experienced the same way by us. But letting them know we understand where they're coming from and their sensations and their responses are real. Vestibular seekers may present as those always on the go kids, the busy bees or the energizer bunnies. They may take movement risks and they love to go fast. It may be difficult for them to sit still, especially if they haven't had the chance to move around beforehand. They may frequently rock back and forth or fidget. They may become excited during movement tasks like climbing, jumping, spinning, and running. And they may be able to do these for a while before hitting that threshold, such as becoming tired or dizzy or feeling done with that activity. These may be the thrill seekers who love amusement park rides, playground equipment, or big trampolines. Some strategies to support vestibular seekers could include incorporating movement into daily routines. So things like jumping between rooms when getting ready in the morning, designating them as a classroom helper or household helper. Things like carrying around papers to pass out, putting chairs away and pushing them in when mealtime is done, grabbing ingredients or bringing groceries in from the store. Pair physical activity before a seated activity to help fill that sensory cup. We want to give them enough input so that their brain is ready to sit and focus. Use a swing if one is available to deliver intensified movement input, especially one that can deliver rotary or spinning input and angular motions, meaning it can change directions and go this way and that way. Create obstacle courses. This can be done at home using couch cushions to safely jump from the couch onto the floor, so we're differing in height. It could include cardboard boxes to create tunnels. You could create different marks using different patterns on the carpet or placing painter's tape down to create a path to balance, tiptoe, or hopscotch along. So adapting your environment to incorporate more movement opportunities. Vestibular avoiders may become upset during movement, especially when moving backward in space, such as during diaper changes or when being lowered into a car seat or a crib. These individuals may appear timid or afraid during everyday movements, such as stepping down off of a sidewalk curb, riding on elevators or escalators. They may even feel nauseous, look flushed, or start to sweat. This is signs of the nervous system kicking in. Some strategies to support vestibular avoiders could include taking breaks from movement activities, having an escape plan or a way to advocate for a break, incorporating routine and predictability related to movement activities, such as walking a familiar way to school, allowing your child to take control of movement as much as possible, lowering babies into the crib face down first and then flipping them over at the end, rather than moving backward through space the whole time. Using a footrest could be a helpful way for your child to feel more grounded rather than having their feet dangling or feeling like they're not sure where they are in space. And coupling movement activities with heavy work. So a little bit more about heavy work. This is related to the proprioceptive system. I had mentioned earlier that proprioceptive input is organizing, meaning it can be helpful when both above and below the band of optimal arousal. It's this magical equalizer that can be a really key regulation strategy. So here on this slide are some heavy work ideas that can be done with materials you may already have at home. The main requirement is that the child is working against resistance or experiencing some kind of input, some kind of like squeeze or push or pull to the muscles and joints. So this is things like rearranging the furniture, pushing those heavy objects around, carrying or moving items. You can fill up a pillowcase. They could have a sack of toys that they carry around and they deliver. Unpacking the groceries or sliding or pushing grocery bags to the kitchen. Making weighted stuffed animals. This can be done by just kind of opening up a seam and putting like some rice or some dried beans in there to really weight it down. Pushing medicine balls, or even if you have mini dumbbells, just watching out for their little fingers and toes. Pushing against the wall, even doing like wall push-ups or chair or floor push-ups where they're pushing their body with their upper extremities. Performing joint compressions. So this is when you're thinking about a joint and you may put one hand below your child's elbow, one hand above, and you're kind of pushing it together. You could do a little pull apart too, and then push it back. And you can do this really systematically. You can, do it on the shoulder, push their elbow towards their shoulder, push the elbow, push the wrist, and you can just go up and down their body with those. Jumping into couch cushions, it could be as part of an obstacle course like we talked about before. Eating those chewy foods, so we're giving that input into their jaw. Drinking liquids, thick liquids through a straw, so things like a smoothie or a milkshake where they're really working to suck those up. Doing animal walk races, so things like you have your hands and your feet on the ground, you're doing big bear walks, or maybe slithering on your belly like a snake, so thinking about different ways to move the body. Playing in weight-bearing positions. So your child could be on their belly, kind of propped up on their elbows. They could be in hands and knees, doing a puzzle, reading a book, watching TV. So just thinking about how to change their positioning up. You could also think about how to adapt other activities. So if they really love coloring or doing maze worksheets, you could tape it to the bottom of a table. So your child's kind of doing it floating above. So all different ways that we're just kind of moving their body, moving their joints in a new, unique way. Pulling on resistance bands, using the gym equipment that you may have at home for yourself. And just a key part here, when using weighted items, we want to aim for about 10% of the child's body weight so that we're not overexerting their muscles, but we're giving them enough input that they could feel it. This is a brief list to help you get started with some sensory strategies to try out for your child. But working with an occupational therapist could result in a more individualized approach where we could help learn and discover your child's sensory profile together. We would work to come up with strategies to help support emotional regulation and participation in daily routines. There are also other types of intervention, utilizing a wide range of equipment and exercises like we saw in that first picture at the beginning, that are found to contribute to long-term changes in the brain that may help with the traffic jam of sensory integration we discussed earlier. Thank you for listening today. I hope you gleaned some helpful nuggets of information, or at least a foundation as you move through the evaluation process. Seek out an OT referral or assessment if you think your child may benefit from a more in-depth look at sensory processing, motor coordination, adaptive skills, executive functioning, or any other factor that may impact the ability to complete activities that they need to do, want to do, or are expected to do. Thank you so much.